Picture this. A woman, 74 years old, retired music teacher, still plays piano on Sunday afternoons, still bakes for her grandchildren. She stands up from her kitchen chair and grabs the table. Just for a second, just to steady herself. She thinks nothing of it. Her doctor would think something very different. Today, I'll tell you why. Because the way you stand up from a chair after 70 turns out to be one of the most quietly powerful predictors of how many good years you have left. Not a fancy scan, not a blood panel, the chair. That's it. I know what this feels like for a lot of people watching. You're sitting on the couch after dinner, the show ends. You go to get up, and your first move isn't your legs, it's your hands. You push on the armrest, you rock forward once, maybe twice, and then you stand. Or you're in a restaurant booth. The bill comes. Everybody else slides out easily. You plant a palm on the table, one on the seat, and lift yourself out carefully. You laugh it off. You say, "These old bones," and you keep moving. Here's what I need you to hear first. That is not on its own a crisis. It's a signal, a quiet one. And most people, and honestly most 15-minute doctor visits, never stop to listen to it. Picture someone in this situation, a composite of a person I hear about often. He's 71, retired postal carrier, still cuts his own grass, feels fine, blood pressure is fine, cholesterol is fine, but over the last 2 years, he started using his arms every time he stands up. He doesn't even notice anymore. His wife notices. She doesn't say anything. That small change, using the arms, is exactly what researchers have been quietly measuring for over a decade, and what they've found should be part of every checkup after 70. It isn't yet. I'm Dr. Aliza Wright. On this channel, I review published research on senior health, the kind of explanation a rushed appointment doesn't have time to give you. I don't treat patients on this channel. I read the studies, I sit with them, and I tell you what they actually say in language you can use tonight. Before we go further, do me a small favor. In the comments, drop 2 things: your age and the city or state you're watching from. I read every one of them, and it genuinely shapes how I record the next video. 5 seconds, drop it below. I'll wait. All right, let's get into it. The test has a boring name, sit to stand, sometimes called the chair rise test or the 5 times sit to stand. Physical therapists have used it for years. Geriatricians love it. And in 2012, a research team led by Dr. Claudio Gil Araújo, working with data published in the European Journal of Preventive Cardiology, made it famous. They followed more than 2,000 adults, ages 51 to 80, for over 6 years. What they measured wasn't grip strength. It wasn't a treadmill. It was something they called the sitting rising test. You sit down on the floor and stand back up, using as little support as possible. No hands, no knees on the ground, no elbow on the floor, if you can, and they scored it. Here's what they found. People who scored in the lowest range were 5 to 6 times more likely to die within the follow-up period than people who scored at the top. Same age, same doctors, same lab work, different chair. Read that again. Same age, same lab work, different chair. Now, most people watching this aren't going to sit on the floor. That's fine. The everyday chair version, the one where you stand from a regular kitchen chair 5 times in a row, arms crossed, is the version geriatricians use in clinics. It measures the same thing: lower body strength, balance, coordination, and something researchers call neuromuscular reserve. Let me explain that phrase in plain English. Think of your legs like a savings account. Every year past about 30, your body makes a small withdrawal. A little muscle here, a little nerve signal there. For most people, the balance stays healthy for decades. But after 70, the withdrawals get bigger. And if you never made deposits, the account starts running low. Standing up from a chair is your body checking the balance in that account. When you push off with your arms, you're not being lazy. You're not being weak. You're your body being smart. It's borrowing from a different account because the leg account is thin. Here's the part almost nobody explains. The problem isn't just the muscle, it's the signal. After 70, the nerves that fire the biggest muscles in your thighs start losing what researchers call motor units. A 2013 review in the Journal of Applied Physiology described it clearly. By age 75, a healthy adult can lose up to 30 to 40% of the motor units in their quadriceps. That's the big muscle on the front of your thigh, the one that stands you up. Fewer motor units means fewer soldiers showing up when you ask your leg to work. The muscle is still there, the wiring is thinner. Now here's where it gets interesting, because this loss is not fixed. It's not one way. And that's the part I really want you to hold on to. The same research shows that adults in their 70s and 80s who begin gentle resistance work can rewire and strengthen those motor units within 12 to 16 weeks. The Mayo Clinic has written about this. Harvard Health has written about this. It's one of the most consistent findings in aging research. Muscle responds at any age. But here's the problem. Almost no one is told about it during a regular checkup. Not because your doctor doesn't care. Because a 15-minute appointment doesn't have room for it. So today, we fix that. I'm going to give you 5 things. 5 concrete steps, not a workout program, not a diet plan. 5 things you can start thinking about tonight and talk to your own doctor about this week. And I'll tell you now, step number 4 is the one that surprises people because it has almost nothing to do with your legs. And step number 1 is the one almost nobody's talking about. Step on. E, learn your own baseline. Not on the floor, on a chair. Any sturdy kitchen chair with no wheels. Sit down. Cross your arms over your chest so your hands are on the opposite shoulders. Now stand up and sit down 5 times in a row as smoothly as you can. Time yourself. Research generally suggests in adults in their 70s who take longer than about 15 seconds to complete 5 stands are showing reduced lower body strength. Adults who can't do it at all without using their arms are the ones who benefit most from starting to train. This is not a diagnosis. It's a mirror. It shows you where the account balance is. Ask your own doctor whether this test is appropriate for you before you try it, especially if you have knee pain, hip pain, balance problems, or any heart condition. That matters. Step 2, train the exact motion. Here's the beautiful thing about the chair. The test is also the training. You don't need a gym. You don't need weights. You sit down and stand UP. That's it. Start with 3 stands, twice a day, morning and evening. Use a chair against a wall so it can't slide. Use your arms as much as you need to. That is fine. That is not cheating. That is starting from where you are. Over 2 to 3 weeks, add 1 stand at a time. Aim gently for 10. Then aim over another month. To do it with your arms folded across your chest instead of pushing off. The Cleveland Clinic and the National Institute on Aging both publish free guides on progressions like this. Not paid, not gated, just there. But here's where most people get it wrong. They do it fast. They rush the stand and they collapse into the sit. That's how knees get sore and how people quit. Slow down. 2 seconds up, 2 seconds down. Squeeze the front of your thighs at the top and breathe. Breathe out on the way up. Step 3, add 1 protein anchor per day. Here's a number that surprises people. Adults over 65 need more protein per pound of body weight than adults in their 30s do, not less, more. A 2013 position paper from the PROT-AGE study group, published in the Journal of the American Medical Directors Association, recommends adults over 65 aim for roughly 1 to 1.2 grams of protein per kilogram of body weight per day. For many women in their 70s, that's around 70 to 85 grams a day. Most fall short. Why does this matter for standing up? Because muscle is made of protein, and after 70, your body is a little less efficient at using it. So you need more of it in each meal to hit the same result. 1 anchor, that's all I'm asking. 1 meal per day with a real protein serving, eggs, Greek yogurt, cottage cheese, a piece of fish, a palm-sized piece of chicken, beans and lentils if that suits you. Anchor breakfast, anchor lunch, or anchor dinner. Just 1 to start. Then, when it feels normal, add a second. Ask your own doctor whether higher protein is safe for you. If you have kidney disease or you're on certain medications, this is a conversation, not a rule. Step 4, and this is the one that surprises people. Sleep. I know. You clicked on a video about your legs, and I'm telling you about sleep. Stay with me. A 2022 review published in the journal Sleep looked at how poor sleep affects muscle recovery in older adults. The finding was consistent across multiple studies. Adults over 65 who slept fewer than 6 hours a night showed measurably slower muscle protein synthesis than adults who slept 7 to 8. In plain English, their bodies rebuilt muscle less well, even when they did the same exercise. So if you're training your legs and eating your protein, but sleeping 5 hours a night, you're rowing with 1 oar in the water. It's not that you can't move, it's that you're working twice as hard for half the result. Talk to your doctor about your sleep honestly, not the polite version. The honest version. How many times you wake up, whether you're up to use the bathroom 3 times a night, whether you snore, that last one especially. Untreated sleep apnea in older adults is one of the quiet reasons legs stay weak. Step 5, balance before you're forced to. The chair test doesn't just measure strength, it measures balance. And balance is trainable. And 2 moves, that's all. Ask your doctor if these are safe for you first, especially if you've had a fall or you're on blood thinners. 1, stand behind your kitchen chair, hands lightly on the back of it. Lift 1 foot just an inch off the floor. Hold for 10 seconds. Switch feet. Do this once in the morning. Once before bed. 2, walk heel to toe along the edge of a countertop, 1 hand skimming the counter for safety. 10 steps forward, 10 steps back. That's it. Both of these. The CDC's STEADI program for older adult falls prevention lists as foundational balance drills. STEADI stands for Stopping Elderly Accidents, Deaths, and Injuries. It's free. Your doctor can pull it up in 1 click. Now, if you have a parent or a spouse or a friend who this applies to, this next part is for them as much as it is for you. Send them the video. It's worth 60 seconds of their time. It might change what happens 10 years from now. Now, I want to answer the question I know is in your head, and it's a fair one. You might be thinking, this all sounds nice, but my knees hurt, or I've never exercised, or I'm 78, isn't it too late? Here's the honest answer. It is almost never too late. There is beautiful research on this. A landmark study published in JAMA back in 1994 by Dr. Maria Fiatarone and her colleagues at Tufts looked at frail nursing home residents. Average age, 87, some over 90. They did a supervised leg strengthening program for 10 weeks, and their muscle strength more than doubled. Their walking speed improved. Some who used walkers no longer needed them. At 87, at 90, 10 weeks. The muscle is listening. It always has been. It's just been waiting for the signal. Let me name the sources one more time because you deserve to know where this comes from. The sit to stand and sit to rise research is largely from the European Journal of Preventive Cardiology, led by Dr. Claudio Gil Araújo. The motor unit loss data is from the Journal of Applied Physiology and reinforced by Harvard Health publications. The protein recommendation comes from the PROT-AGE study group, published in JAMDA. The sleep research is from the journal Sleep, 2022. The balance drills come from the CDC's STEADI program, which is publicly available on the CDC website. And the strength training in the very old is Fiatarone's JAMA study, still cited today. None of these are fringe. None of them are hidden. They just don't fit in a 15-minute appointment. Now, red flags. There are moments where this video is not the right resource. Call your doctor today, not next week, if any of these apply. 1. You've had a fall in the past 6 months, or 2 near falls. That needs an in-person evaluation. 2. You've noticed sudden weakness in one leg or one side of the body. Sudden, meaning within hours or a day. That is not a chair problem. That is an urgent one. 3. You feel dizzy or lightheaded specifically when you stand up. Especially if it's new, that can be a blood pressure issue or a medication interaction, and your doctor should know about it. 4. You have chest pain, shortness of breath, or a racing heart when you try even light activity. Stop, call. 5. Your knees or hips have been giving out, buckling, or making you catch yourself. That is not something to train through. That is something to have looked at. These are outside the scope of a video like this. They need direct evaluation. Let me run through the core points quickly. 1. The way you stand up from a chair after 70 is a real, measurable signal about long-term health, and it costs nothing to check. 2. The signal isn't destiny, it's a mirror. 3. Standing up from a chair slowly and repeatedly is both the test and the training. 4. Protein and sleep are not side notes. They're part of the same story. You can't out-train them. 5. And it is, almost never, too late. Here's the whole message in one sentence. Your chair is not your enemy. It's your first honest conversation with your own strength. If this helped you see something new, subscribe. Next week, I'm walking through something I hesitated to record for a long time. The one common blood pressure medication timing question that most people over 65 have never had answered. and what the current research quietly recommends? In the comments, tell me. How many seconds does 5 sit-to-stands take you? Just the number. I'll be reading. And one last thing before we go. I said earlier that the account can be refilled at any age, but there's one small piece I haven't told you yet. The people in these studies who improved the fastest weren't the strongest ones. They weren't the youngest. They were the ones who checked their own baseline first, who wrote the number down, who knew where they started. That single act of measuring is why the training worked. It's the whole reason next week's video matters too. Take good care of yourselves. I'll see you next week. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.